Opposition spokesman on health and wellness, Dr. Alfred Dawes, today pushed back on claims by Health Minister Dr. Christopher Tufton that the healthcare sector is doing better than ever. Speaking at a media briefing in Kingston, the medical doctor says the healthcare system will continue to produce horror stories. Courteney reports.
And until we do so, we will be left with horror stories because the broken system is going to continue to produce horror stories.
More conversations stir the air surrounding ventilators in Jamaica's healthcare system. Opposition spokesperson on health and wellness, Dr. Alfred Dawes, at Wednesday's media conference sought to address what he calls fuzzy numbers released by the Minister of Health, Dr. Christopher Tufton, in response to the number of ventilators in the public health system.
Politics is killing health. It has borne out in the fact that many of those who supported me back then in my quest for a better public health system are now my most vitriolic accusers and critics. My motive has not changed, whether this administration or a PNP administration.
Dr. Dawes mentions donations of ventilators and grant funding through the Program for the Reduction of Maternal and Child Mortality, PROMAC. However, he believes a proper system seems to be the issue.
So the stories that we are seeing are not unexpected because they reflect a systematic issue. And a big part of that systematic problem is that we have a maintenance issue and we have accountability issues.
Health and Wellness Minister, Dr. Christopher Tufton, has since refuted suggestions regarding the PROMAC initiative.
There is a report that can be had to clarify any misunderstanding or address any mischief as it relates to the PROMAC program. The fact is that many hundreds of Jamaican mothers and their neonates who are involved in complicated pregnancies and delivery have been supported by the PROMAC equipment and where the buildings exist through the PROMAC facilities.
The PNP spokesman is, however, demanding a proper report detailing the location of the ventilators.
I never made any assumption that ventilators were missing. You can account for a ventilator that is in a box. You can account for a ventilator that is missing an air compressor. But that does not mean that there isn't a shortage of working ventilators. Where are the working ventilators?
Dr. Dawes is urging the government to be clear in the information it gives.
In politics, there is the truth, there are lies, and then you have to look at clarity. And truth without clarity breeds the proliferation of lies.
We will clarify that because I believe the Jamaican people deserve the truth and transparency around what is happening. So if we have to repeat it, we will.
Until then, the opposition fears an air of uncertainty lingers around the number of working ventilators in the country. Courteney for CVM News.